It wouldn't have been possible for me to go to school if it wasn't for donors or for the scholarships that I received. I'm a first-generation college student. I grew up in Detroit, Michigan. My family didn't have much growing up. I needed to figure out how to pay before going to Bowling Green. But I wound up going and stepping out on faith. I was able to obtain half of my tuition through the scholarships that my high school counselor sent out. And then once I got to Bowling Green, I also received a partial scholarship, which made up my tuition. Since being a freshman in college, I always wanted to be a donor myself. My name is Krystal Owens. I am the Director of Student Affairs, College Registrar, and Director of Nursing Workforce Diversity. My dad talked a lot about race growing up and the struggles actually that he had as a Black teenager and a Black child growing up in the South. He struggled a lot with connecting with his healthcare providers because in his personal life, he didn't have anyone who was different from him. He had to find a way to dive deep to trust his providers. My dad also made sure that every healthcare provider called him Mr. Owens. In that environment, he was able to take some of that back and demand the respect that he didn't get before. So fast forward to when my dad had a liver transplant surgery my senior year of college. He had a young white female nurse. I'm confident that she was fresh out of school, but she had so much energy. She knew the rules, that it was Mr. Owens, and she came in, she greeted him, she asked him about his day. It was really building that rapport, and that meant so much to him. And then so she was, I guess, going through her check of him and noticed that his feet had started cracking. And said, well, do you mind if I lotion your feet, Mr. Owens? And she didn't use gloves, she just went in, and that gesture meant everything to him. And that moment, that young nurse she earned the privilege of calling my dad John. Benjamin, my firstborn, was born December 2010. And soon after having him, I started experiencing postpartum depression. This was something new for me, also for my family as well. It's not something that we talked about in our community. The common thing I was told was to shake it off. You got this, Krystal. You're so strong. And for me, I couldn't understand how I could experience depression after having my son that I love so much. If I fast forward some to December 2013, and my son was going on 3 years old, I was starting to experience a severe depression. I'm a believer, but the thoughts that was in my head, I couldn't focus on my belief at the time, and so my ounce of hope was really Benjamin. And I'm so happy that I had that ounce of hope. I had decided that it was best for me to check myself into a psychiatric hospital. It was the scariest time of my life. It was my first time being away from my son, but it was what saved me, and the compassionate care that was provided to me, not only by social workers, but really by a psychiatric nurse practitioner. The time and the compassion and the care that I received was, I can't even really put words to it, to be honest. I'm learning a lot about myself this past year, and I am growing in ways that I never imagined that I would grow. And I want to take a big leap, a big step, and I want to talk about my mental health journey because I want to be a part of breaking the stigma behind mental health. I wanted to initially loop in students who have experienced mental health challenges or students who wanted to go into the mental health field. I wanted to open up another endowment for a new scholarship that will be called the Krystal K Owens Recognizing Mental Resilience. If we think about physical health versus mental health, if you broke your leg, I'm not for sure that anyone will respond after going to a doctor and saying that your leg is broken to say, shake it off, like it'll be fine, or you're stronger than this, it'll be fine. But oftentimes those are the responses that individuals who are experiencing mental health challenges they receive. When I think about the Recognizing Mental Resilience Scholarship, I want to dedicate it to anyone who have experienced mental health challenges. I want to also dedicate it to anyone who have been silenced on their journey, be it through embarrassment or a forced silence, because neither should happen.